Good evening and welcome to this special webinar about the COVID vaccination program and how here in Lozells and across Birmingham and the West Midlands, the NHS and other colleagues have been working on the COVID vaccine. I want to say a big thank you to the panel who I'll introduce in a second. But I just want to remind everybody we are living in very, very difficult times. This pandemic and the fight against this pandemic is ongoing. Many of us, including myself, are having to deal with relatives, family, and friends who are unfortunately having to are passing away because of this COVID-19 illness. So it's incredibly sad times. I want to send out my condolences to the family and friends of all those who have lost relatives. I lost somebody very, very close to me on Saturday night, and it's been devastating. The last few days for our family has been incredibly difficult. I know families right across the country, right across the world are going through this very, very difficult time. But the light at the end of the tunnel for us is the vaccine, and the rollout of the vaccine has been in place. And today we will look to discuss the vaccine itself, the program, and also to look at some of the information and misinformation that's being circulated. And I know there's anti-vax campaigners who are putting out information on WhatsApp groups and social media. And I know there's a lot of fake news that's being spread, but there is also some genuine concern out there in the community, and it's concern that we hope we will start to address today, so people do have the confidence to be vaccinated. I know many people are being vaccinated, but I know there are some concerns. And in particular communities, I know the ethnic minority community is particularly low on vaccination take-up. I was speaking to a GP here in Lozells earlier this week, and they're already on to priority group number 4 because approximately half the people that are being offered a vaccination are not taking it up. And these are vulnerable people, vulnerable elderly folk within our community who we really need vaccinated. So hopefully today we'll take your questions, we'll take your comments, we'll have a good discussion with a panel of experts who know it all, and let's try and get all of us get together and try and increase the level of vaccination in our communities. Now, moving on to the panel, I'm joined by 3 fantastic folk from the NHS, and I'm very, very grateful that they've joined us. We've got Dr Masood Ahmed, who's the medical officer from the Black Country and West Birmingham CCGs. Good evening, Dr Masood.
Good evening.
We've got Pip Mayo, who's the West Birmingham NHS Managing Director. So she's relatively new into this role, and we'll find out shortly what each and every one of them do. And we're also delighted to be joined by the chair of the Sandwell and West Birmingham Clinical Commissioning Group, Dr Ian Sykes. So I'm very grateful to the 3 of you. Good evening to you all. Before we move on, I want to very quickly go to you as a panelist to really ask you what your roles are generally and what your role is currently in this pandemic, and particularly around the vaccination. So, Dr. Masood, do you want to tell us a little about your role in this?
Thank you. So I'm the Chief Medical Officer for the Black Country and West Birmingham CCGs. And what that means is that I have responsibility, if you like, for the population. And that population is 1.5 million people. So my normal day job would be looking at what we do as the Black Country in West Birmingham in terms of making sure that we have the right services, that we have the right care in place, and tackling our problems in terms of ensuring that we actually are getting healthier as a region. And certainly that would be my normal focus. I think in current times we are busy with the pandemic. And so a lot of my role nowadays is about understanding the impact that COVID is having and helping with the vaccination planning, ensuring that actually we have vaccination supplies in the right areas, ensuring that our primary care networks, which are a group of GPs, they have the right sites, they're able to engage with our population, ensure that they're getting that vaccine, as you said before, but also ensuring that our hospitals are up and running. And we will also be having larger vaccination sites come online in the next few weeks. So really, it's about ensuring that as supply comes through, we'll be able to vaccinate as many people as fast as possible.
Great. Pip, what's West Birmingham and what does the West Birmingham NHS Managing Director do?
Okay, thanks, Councillor. It's a good question. So my name is Pip Mayo, Managing Director for West Birmingham, and what that means is that I've got a specific remit to make sure that the health services that are delivered to the population of West Birmingham are as good as they can be, and to work with local communities to listen to their concerns and to tailor responses to them so that they get the health care that they need and deserve. And that's it really in a nutshell. Thank you.
Thanks, Pip. Dr. Ian, so what is a CCG? What is the role of a CCG? And tell us more about the Sandwell and West Birmingham CCG.
Right. So I'm a GP by trade and actually live and work within Sandwell, and I'm the clinical chair. So that's specific. It's a clinician that leads that, and it's the clinical commissioning group. And essentially, I am therefore the clinical leader to try and help to lead and to manage the service. And essentially, what we do is we have a huge pot of money. Our CCG has around about £800 million, and our job is ultimately to buy most of the secondary care services. So that's the hospital services when people go into hospital, and also our primary care services. For most people, those are the community services such as district nursing, and also our GP services. So my job is to help oversee ultimately the team to try and ensure that we continue to commission and buy in great services in our communities, and also for the hospital care for those people that are unfortunate enough to need that. Within the COVID crisis, I'm also there helping to lead on the COVID crisis, and I will be helping to lead in my own practice on providing immunisations for our patients. And actually, because of the nature of the crisis, I'm actually also doing some work within our emergency department at Sandwell to try and help them through this very difficult time.
Great, thank you to our panelists for your brief introductions. Now, before we get into the vaccine, off air, we were having a conversation around the current situation with COVID. And just before I go to Dr. Masood, I want to remind colleagues, if you've got any questions, any comments, whether you're watching this on Facebook or YouTube or any other platform, if you type them in, hopefully we can put your questions and comments to the panel in the second half of this program. So we want to have a quick discussion for the first half an hour, and then from 6:30 till 7, we will hopefully take your questions and comments and get the answers to your questions. So Dr. Masood, what is the current situation in hospitals across our health service in terms of COVID?
Well, look, if you've seen the news, you'll know that things are bad. And I think it's very difficult to argue any other way. We've had reports from, through misinformation, through sort of WhatsApp and Facebook, that our hospitals aren't full and that, this is all a hoax. I can tell you that, the hospitals are full. The hospitals are at bursting point, and our healthcare staff are working full stretch. In terms of what's happening with COVID, well, we're now in the second wave. I think in the last few weeks, we've seen a steady increase. I'm hoping that actually we are at a peak, but it's difficult to tell because the numbers keep changing. Saying that, the pressure on our hospitals is still increasing. And so I would say that we're really having a tough time. But in spite of that, I think we do have hope, and hope comes from the vaccine. So really, we started the vaccination program in December. And since then, as a region, we've done really well. All of our primary care networks, they've set up vaccination sites. We've got 24 of them across the region that are live. And they're working at full stretch to vaccinate as many people as quickly as possible.
Thank you for that, Dr. Masood. So, Dr. Ian, how important is this vaccine to get us out of this pandemic? What role will this vaccine and this vaccination program play?
Okay, hopefully this vaccine is going to be our one big opportunity to try and progress through this. What the vaccine will hopefully do is to, first and foremost, and this comes back to the strategy where there's been some confusion about the first and the second dose, we know that huge numbers of vulnerable people are going to hospital, very ill and dying. What we hope this vaccine will do is to prevent them from going into hospital and dying. The good news is that for most people, the vaccine will actually stop you catching COVID at all. However, we need to bear in mind that for a small number of people, it won't necessarily stop you from catching COVID. However, we're very confident that what it will do is to stop you becoming very ill with COVID, and therefore it will almost certainly stop you having to go into hospital with it, and it will stop you dying. And therefore, the faster that we can administer this vaccine to our particular most vulnerable communities, it will help to keep them well, it will help to keep them at home, and it will therefore have a significant impact on reducing the pressure on our NHS and allow the NHS ultimately to get to treating all the other problems that people have, such as cancer. That's what this vaccine is going to give us.
Thank you, Pip. Before we start discussing the vaccine itself, I wanted to get some more information about how it's being administered across not just Lozells, but across Birmingham, across the West Midlands. Could you give us some information about how it's currently being how the program is being rolled out? We hear on the national news that the West Midlands has had more vaccinations than any other region. Do you want to shed some light on that too, please?
Yes, I can do. Thank you. So at the moment, we're hearing that the West Midlands is leading the way in terms of the number of vaccinations that have been delivered since just before Christmas. And to talk about the various places that people can get vaccines. So all of our GPs at the moment are delivering vaccinations to their registered patients. So they have come together to create local vaccination sites, and there are 24 of those across the Black Country in West Birmingham, and there's 27 of them across the rest of Birmingham and Solihull. So you can see that there's a lot of those in local areas. The GPs have been contacting people and inviting them to come and have their vaccination. So many of you may have had a call inviting you to go to your GP surgery, or your relatives and loved ones may have done so as well. So they've started with the over 80-year-olds and care home residents, and are working their way down the cohort groups. So over 75s, over 70-year-olds, and gradually working their way through from the communities that are most at risk down to through the whole population. So we've got that going on at the moment. In addition, vaccinations are being provided from all of the hospitals across the Black Country, Birmingham and Solihull. And they're mainly vaccinating local health and social care staff to make sure that those who will continue to care for us through this really difficult period can themselves stay well. In addition, if you are going through a hospital or you have an outpatient appointment, then you may well be offered a vaccination whilst you're at the hospital site. So they're working really hard as well. In addition to that, there are some large vaccination sites that have set up, and many of you that are listening tonight may have heard about the Millennium Point mass vaccination site that's now open. You may receive a letter giving you an option to go there as well. And there will be one opening shortly at Aston Villa, which we know is quite close to the area that we're talking about. So you could be approached by your GP, and you could also receive a letter to do a booking for one of these large vaccination sites. And you have a choice really as to which one you go to. My only advice on it would be go to one of them when you get a call up. Take advantage of it and go and get your vaccination. So I think those are the main routes at the moment by which people can access their vaccines. In West Birmingham, there are 3 GP locations at the moment who are doing them. So we've got one on the City and Sandwell site. There's one in Lozells at the Enki Medical Centre, and there's one at Summerfield Primary Care Centre as well. So hopefully people will find something that's close to them and convenient to them. Sorry, one other thing that I should have said is for people who are housebound and can't get out to go and get their vaccination, the district nursing teams and other teams are going out to make sure that local people who are housebound can get their vaccination, because that's really, really important. So thank you. There's a range of choices there.
Pip, there's been some myths and rumours circulating that we won't have enough vaccines, and when we do get enough vaccines, they won't be the logistics are not in place to get the vaccine to our communities. Can you confirm or deny any of these?
I think the vaccination programme, we'll have seen it in the press, is one of the largest and most complex programmes that has been rolled out across the NHS for a very long time. And the logistics behind it have been huge, and it's been a real testament to everybody who worked over the Christmas period to make sure that this was delivered to local communities. Now, when you run anything to try and vaccinate the whole of the adult population in a very short period of time, there are some initial teething problems, but that's all that they have been. And now there are vaccines in all local areas for all local communities, and they're being delivered fantastically well. And I can only say, it's been the most amazing logistical effort to do that. And the supply now is picking up as well, which is fantastic.
Great, thank you so much for that, Pip. I know many of you are watching, and we will be taking your comments and questions in the second half of the program. I want to give a special shout out to someone. Helen Kilminster is actually one of those who's watching the program. I know she's been doing a remarkable job as the clinical director of one of the vaccination hubs locally to us, and her work has been particularly impressive and when it comes to engaging with the ethical. Let's now talk a little about the. Let's talk a little now. So, what is the vaccine? What is it? Is it a pill? Is it an injection? What is it?
Do you want me to have a go at trying to explain that? I know sometimes the sign goes a little bit. Can you hear me, Councillor?
I can. So, I was asking, can you hear me now? I'm having some.
Yeah, I can hear you.
We had a bit of trouble.
So I was asking Dr. Yeah, tell us a little about the vaccine itself, please.
Ian, why don't you answer this? Sorry, we are losing you at times.
Yeah.
Ian?
Okay, so essentially what the vaccine is, there are slightly different ways of making the vaccine. I don't want to get too complex into it. What I will state is that it is being, I suppose, engineered. However, it is safe. It contains no animal products at all. It is a variety of chemicals. What it actually does contain is a piece of what we call RNA, and that is the chemical, I suppose it's the memory bit. It's what actually makes the virus able to transmit itself. A virus is something that can't actually grow, but it has to grow in other cells. What this vaccine does is to put a little bit of RNA, that's the messenger of the virus, and it gets this to go into our own cells. Those cells then make this RNA, except this RNA is perfectly safe. It's had all the nasty bits removed from it, for want of a better word, but it's to try and trick the body into thinking it might have coronavirus. So therefore the body starts to mount what we call an immune response. The body then makes immune cells, called B cells and T cells. And these cells are the cells in the body which will actually then attack the virus and kill it off if the virus gets into our own body. So that's essentially what the virus is. It's a small package of RNA, that's the memory of the virus, to stimulate the body to produce an immune reaction, which then means if the real virus gets into our body, then it can hopefully kill it off and stop it causing any damage. And I can reassure you the virus itself is completely inactive. There is nothing growing in it. It cannot cause coronavirus. It cannot grow within you. It's an inactive virus. It's perfectly safe, and it's designed to create that immunity. So that's actually what it is. There are slightly different ways of producing it, but essentially all the viruses that are currently available to us do exactly the same job. For those who are a little bit more technically minded, it's actually producing a response to what we call the spike protein, and it's the spike protein on the virus that these immune cells can recognize. And that's essentially what it is.
Thanks for that, Ian. Apologies, I was having some internet connection problems there. There's a number of different vaccines. We've got the Pfizer vaccine, we've got the Oxford vaccine. I think there's others that have now been regulated. Which one is safe, or which one is safer than the other? What would you say clinically is the best vaccine? Masood?
So actually, you know what? Both of them are really safe. We've been really fortunate that as soon as the pandemic started, a number of companies worldwide focused on developing a vaccine. And one of the things, and this is the remarkable bit, that actually no shortcuts have been taken. The only difference has been that actually we've smoothed out the process. So normally it might take 5 to 10 years to produce a vaccine. But because the whole world has been working together, it's meant that we've done the research, we've got the results as quickly as possible. We've done trials. You know, we've done trials that have included 40, 50,000 people. And that's what you would normally expect. And then we've gone through a very rigorous process to ensure that these vaccines are safe and they are effective. And in the UK, we have a body called the MRHA, and they are the ones that approve the vaccine. And that's the key thing here, is that we've not taken any shortcuts. We've stuck to the rules, the very rigid rules, to ensure that actually the vaccine and both vaccines that have been approved are very safe. In terms of which one is effective, it's very difficult to tell. What we do know is that both of these vaccines are very, very effective. And certainly, you know, once you've had the doses and you've built up the immunity, we're looking at over 90%. And that's fantastic protection. But the key thing is to remember that this doesn't necessarily reduce transmission. What it does is it prevents severe disease. And that's the worrying thing about coronavirus, is that a number of people, when they get ill, they can go downhill very quickly. They can go into hospital, and that's what we're seeing in our hospitals, that they need to have ventilators and they need support. And really, by giving the vaccine as quickly as possible to as many people as possible, what we're doing is we're reducing the severity. So it doesn't mean you won't get ill. It just means you'll have a milder illness than if you didn't have the vaccine.
So the vaccine is key to stopping the hospitalization of our community. Is that ultimately what you're saying?
It's very important, very important. And look, we've seen that a number of our vulnerable communities are the ones that are taking the hit, if you like. So in terms of prioritization, we've got an organization in the UK called the JCVI, and they've created a priority list. And what we know is that it's the over 80s who are most likely to die. And that's why we've prioritized the over 80s. But as we move along those priority groups, we're adding protection and sort of helping reduce those deaths, helping reduce hospitalizations. And I think that's where it's really important that, you know, all of our elders, when you get the call, when you get the text, the email, that you take up that opportunity to get vaccinated.
But Dr. Masood, I often hear from people who say that, how is it that we've managed to get these vaccines, more than one vaccine, developed, agreed by regulators and out in the market, when there's other illnesses that we still haven't found cures for? How would you respond to those questions? You know what?
It's because the world has focused on finding a cure and finding a solution. That's the simple reason. You know, you asked me at the beginning about what my day job is. Well, the struggle is to do your day job and to do all of the COVID planning. As Pip was saying, the reason we have done such a great job in terms of getting the vaccination program moving is because we've been planning this for months. You know, as soon as we were given notification that in December we were likely to get vaccine, the amount of work that's gone on in the background is phenomenal. And you know, you're talking about people that have been working well beyond their hours on the weekend. You know, a typical day for myself or any of my colleagues is that we are in meetings, we're engaging, we're discussing, and actually most of the time our work doesn't finish till well past, you know, sort of 10, 11 o'clock at night. And then it's again the next day. So really, everyone within the NHS, everyone on the front line, everyone in the background is working all hours of the day. And that's the reason we've got where we are, because of the human spirit. You know, and that's why with all that hard work, what we really need is for our communities to take up the opportunity and get vaccinated. Because again, that is what is going to protect not just yourself, but it's going to protect your families and it's going to protect the NHS. And I would say that, you know, especially with our younger folk, you know, encourage the elders, make sure that they go and they get their vaccination. It's really important that, you know, in something like this, we don't believe the misinformation. Go to trusted sources. I mean, I can tell you, I've had the vaccine, and equally, my parents have had the vaccine. They had the vaccine last week, and I was so relieved because it's that bit of protection. Because, you know, if you get the opportunity, if you get the call, don't ignore it. Don't refuse it. Go and get vaccinated, because we're doing everything we can, and it's really important that the community does what they can as well. The sooner we all get vaccinated, the sooner we will basically, you know, get the upper hand in this fight against the coronavirus.
Can I just make one extra comment there, Councillor, if I may?
Yes, please.
Just following on from what Masood said, so there was some concern about how we managed to get a vaccine out so fast. We need to bear in mind that all our pharmaceutical companies are making millions and millions of vaccines every day. Every year we make a flu vaccine, and that flu vaccine alters from year to year. So the fact that we can get these vaccines out isn't something new. Our pharmaceutical companies are used to making, designing and refining vaccines every single day. This is just part of their job. What they've done is to step up the plate and get this done as soon as possible, and therefore try to put all their resource into that. So this isn't something that's just happened overnight. It's the fact that our companies are there, they have the resource to do this, and I think the flu vaccination is a good example that they're changing this every year. Hence, this is just one part of their job. They've just done it fantastically well. And again, like Masood, I also want to say that I myself, I've also had my vaccine as a frontline healthcare worker, and I wouldn't want to recommend anything to anybody else that I'm not prepared to have it myself. I was really pleased when I had mine. So I'll stop there. Thanks, Councillor.
Ian, just a follow-up question about the vaccine itself. So what are the potential side effects for the vaccines? And secondly, is there a group that is not recommended to have the vaccine? So there's a lot of talk that if you're pregnant, that you shouldn't take this vaccine. So can you clarify or confirm these, please?
Yes, first of all, as I say, it's a very safe vaccine. Yes, there are side effects. When I had the vaccine myself, I actually had quite a painful arm for about 24 to 36 hours. I felt very mildly flu-like for about 24 to 36 hours. So I had my vaccine on a Tuesday afternoon. I felt a little bit unwell Wednesday afternoon. By Thursday morning, I was completely back to normal. So to be honest, most people are going to get some side effects from this: mild headache, mild temperature, feeling a bit lethargic. In the vast majority of those cases, those symptoms will resolve within 48 hours. The important thing is to confirm again, as I've said before, this contains nothing live. In some ways, getting some side effects is quite a good sign. I was actually quite reassured in a way, because it told me that the immune system was working and it had recognized I'd had the immunization and it was starting to activate my immune system. So yes, you will probably get some side effects. We think between 50 and 80%. So the majority of people will get some side effects. They're short lasting and they should have pretty well resolved completely within 48 hours or so. So that's the first thing regarding the vaccine itself. Regarding who cannot have it, well, the interesting thing there is almost nobody who cannot have this vaccine. those people who have had a severe reaction, what we refer to as an anaphylactic reaction. Those are people that may carry a special pen with them called an EpiPen, which contains adrenaline. So those people who've had a previous anaphylactic reaction to any vaccine, or if we think they've had any reaction to a possible component of these vaccine, then unfortunately, those people shouldn't have this vaccination. The number of people that would apply to is very, very small indeed. Even those people who've had an anaphylactic reaction, they probably can have it, but they would need to be closely supervised, and that would need to be discussed with their doctor. So in some cases, there are a very, very small number of people who would recommend shouldn't have it, but it's very small indeed. The other issue is that you mentioned about people who are pregnant. The initial advice was that probably people who are pregnant shouldn't have it. That's not because we thought it was dangerous. It's just simply that you cannot test a product like this on people who are pregnant because it would be unethical. However, we know from experience with the flu jab, for instance, that actually these vaccines are incredibly safe, and there's been no reported significant evidence of them doing any harm to women who are pregnant. So the feeling is that whilst we wouldn't ordinarily call people who are pregnant up, we would certainly call them, have a discussion with them, and the doctor or clinician and that patient would have a discussion to decide, is it in their best interest? Are the risks of COVID greater than any potential risks of the vaccine? And I suspect in most cases, the risks of COVID are far greater than any possible risks from the vaccine. So although we would want to proceed with caution, in fact, the majority of pregnant women probably can have this injection perfectly safely.
And your advice for anybody who's considering a vaccine and they're either pregnant or they have some other concerns is to speak to their GP, who would obviously have the relevant information with respect to their health.
Yes, so they would be able to have a discussion with them and then come to a mutual decision, is this vaccine in their best interest? And as I've mentioned before, in the vast majority of cases, the clinician was saying that, yes, this is definitely in your interest because any theoretical risks of the vaccine, I think, would be more than outweighed regarding the benefits of preventing you from getting into COVID. As we've said, we only heard a couple of days ago, this disease is killing thousands of people every day. And this vaccine will prevent that.
Great, thank you. Pip, moving across to you. So there's been a slight change in the rollout in terms of the 12 weeks between dose 1 and dose 2. Why was that decision taken by the NHS and the government?
Well, this is partly a clinical question, actually. So I might pass the answer to that back across, if you don't mind, to Masood, who I think
shall I take this one?
Can probably pick it.
Yeah. I think that's a very good question, because that's what's caused some of the confusion. And I think one of the things is that when we looked at the supply that we had and we looked at what was the goal, and the goal here is to protect as many people as possible. Now, when you've had a single dose, you're looking at getting 50% protection within a couple of weeks, and then that slowly rises. And I think the concern is, if you have 1,000 people, do you protect 500 with 2 doses, or do you protect 1,000? And I think the thinking behind the strategy is really you want to protect 1,000. So those 500 will not get the same protection as if they've had 2 doses. But the key here is that we need to save lives. We need to protect as many people as possible, because it's those that actually get ill, they deteriorate rapidly, and then if you go into hospital, if you go into critical care and you're on a ventilator, the chances of not making it, they increase significantly. So if we can stop people getting to that stage, then we will protect people. So again, by having a single dose, waiting for 12 weeks, the reason is just to protect as many people as quickly as possible.
Dr. Masood, right from the very outset, there's been a number of inquiries, task force reports from national government, from regional government, from local government, from political parties that have said that Black and minority ethnic people are disproportionately impacted by this illness. And there's obviously been a higher rate of positive COVID cases and unfortunately a higher rate of deaths within those communities. And it was quite surprising to some that when the classification came along in terms of the order to vaccinate in terms of age and then going down to group number 6, which I'm part of, if you're aged between 16 and I think 59 or 64 rather, and are clinically vulnerable. But don't you think there should have been a classification within those groups for the Black and minority ethnic group? Because the data was all saying that, but yet the decision makers decided against that. What are your thoughts on this?
Councillor, it's a really difficult one. What we do know is that actually the biggest group that dies the most, they are the over 80s and then the over 75s. But you've made a very good point. We have a number of vulnerable communities, whether they are those from a South Asian background, whether they are those from an Afro-Caribbean background, whether they are those that have comorbidities, are suffering, are having chemotherapy. And so there are a number of subgroups, if you like, that are at increased risk. And certainly the decision that the JCVI took was when they created that priority list, they're looking at the biggest group and they're looking at the biggest benefit as quickly as possible. Now, it's a very difficult decision to make, and I understand why you're asking the question. I've looked at the data and I've looked at the evidence, and on the whole, I think there is a lot of science behind why these decisions have been made. And I think the important thing is to realize that these decisions are being constantly reviewed. So if we start to get more information that says, actually, we need to change the strategy slightly, then I'm sure that's what will happen.
Thank you for that. Pip, we've got a lot of folk watching, and we know there's a lot of community groups, activists, volunteers, people who really care about the community, and the response from communities right from day one of this pandemic has been huge. Many of them want to help within the vaccination program. So what advice do you have for them? How can they help? How can they get involved? Who do they contact if they want to volunteer to help at a vaccination hub, or just want to help in terms of communication too? If you answer that, I've got a supplementary question for you too, but if you take that one first, please.
Yeah, that's no problem. So in terms of the ways that people can help, there are opportunities for people to volunteer to be part of the programme in a formal way, and they can volunteer either through the Dudley group in the Black Country or UHB in Birmingham. So there are two contacts there which I'll share with you afterwards, Councillor, if that's okay, so that they can be made available for anybody who wants to do that. And that's for a whole variety of roles. So whether anybody's got clinical skills and they want to return to help out, or whether, like me, they're not clinically trained at all, but they could help with marshalling and supporting people when they come through the vaccination site. So there's a huge scope there for people to get involved. So that's the kind of formal thing about getting involved. But there's something I think that's much softer than that in terms of involvement. So we know that people trust people that they know well, and family members and people that they respect in their communities, and I think that there's a huge role for all of us to play here, to share positive messages about the vaccine, to encourage people to take it up when it's offered to them, and I think also to ask those who are older and who we love as part of our families and our communities, whether they've had that call yet, because I've heard many stories from friends of mine of people whose older relatives have received the call, but they were maybe a bit confused about what the call was about, or they said, I'm not sure about that at the moment, I'll come back to you. So there's something about being really active in this space and checking in with our relatives, checking in if they've had the call, checking in if they feel comfortable, spreading positive messages, and really encouraging as many people as possible to take advantage of this. And where there are concerns, encouraging them to come and ask those questions. So I think there's a range of things that communities can do, and really it's through communities that will build, I think, a lot of confidence in the vaccine. The national messages are one thing, but hearing it from a friend, a family member, or somebody that you trust and respect is so much more powerful every day of the week, I think.
Great. When I advertised this program on social media, I had a few people message me saying that we should also look at having similar webinars in some community languages, and I hope we can have a webinar in a number of community languages moving forward. And I know colleagues from Citizens UK Birmingham, organised by Saidul Haq Saeed, they organised a webinar this afternoon with a local GP in Bengali to get the messaging across, particularly for those where English is not your first language. Are the CCGs or is the NHS or anybody else looking to, are they looking to publicise videos, particularly from doctors? Everybody trusts doctors. I think the level of trust with compared to politicians and doctors, people, not everybody, absolutely trust a GP far greater than politicians, and quite clearly everybody loves the NHS too. So, are we looking at anything along those lines?
Yes,
yeah,
we
certainly
are. So there's information in a range of community languages, and I'll go on, Masood. I'll let you come in. You've been a bit closer to the development of some of them.
I was going to say I've been involved in a number of these projects that are happening both nationally and locally, and there is a lot going on. But the key here is that what we're trying to do is disseminate information through the networks. So rather than, big bang and have it everywhere, it's actually through those trusted sources. And again, as you've said, having information in different languages is really important, because sometimes not everyone has English as their first language, or they may miss some of the important information. One of our GPs has done a fantastic job, a Dr. Samara Afzal. She tweeted a message in Urdu, and it went out, and last time I looked a few days ago, she'd had over 60,000 views. And I think that just shows the power of, if you like, social media and the platforms, and whether it be Facebook or YouTube, I think the message does spread. And sometimes we need to think about what language we use, what format we use. Sometimes people don't have access to social media platforms, and therefore we're also doing a lot of engagement work where we're also sending out, we've got posters and we're sending out leaflets and so on. So there's a lot of work going on. But equally, we're listening, and we're trying to hear what are our communities saying? What is it that they need? This is one example of a webinar where we're very grateful that you've invited us. But certainly there are a number of webinars that I'm attending next week as well. One of those is with Black community leaders and faith leaders. Another one is with the NHS Muslim Network. So look, if you're able to get people together, ask us. We will happily support you. And I think, again, that's the most important thing. There are trusted sources. Listen to the people that have expertise, that have studied medicine, understand healthcare. You wouldn't get onto a plane if the pilot wasn't properly trained. And this is the same, that if you're looking for healthcare advice, go to healthcare professionals. Don't believe everything that goes around on WhatsApp, because these aren't experts. It's very easy to get confused. It's very easy to believe the misinformation and think, oh, well, I wonder if that's true. And that the same goes for cures as well. Don't suddenly think that drinking lemon in hot water is suddenly going to protect you from coronavirus. There's no evidence for it. And again, it's well-meaning. I've had I've had aunts of mine send me a video, and I have to ring them and say, look, by all means, drink honey and lemon and hot tea. Those things, they're not going to be bad for you, but don't think that they are going to protect you. Again, it's wash your hands, socially distance, wear a mask. At the moment we're in lockdown, don't go out. My parents have had the vaccination, and I've said to them, that doesn't mean you can now go out and meet people. Absolutely not. You still have to be careful. You still have to stay at home. You still have to be cautious. And again, it's not just about protecting yourself. It's protecting those around you, protecting your loved ones. And that comes from the physical interventions like hand washing and safe distancing and wearing a mask, but also by encouragement. Encourage those around you to get the vaccination and not to refuse. That's what's really going to make a difference.
Hi, sorry, my internet was playing up there again. Right, we're going to now take some questions and comments have been posted on the various social media channels. I'm going to take those questions and comments which aren't necessary compliments, but thank you to everybody who's given some positive feedback about this program. But we'll take some. We've got a comment here from Legacy West Midlands. There's a nice picture of Aftab there. I can confirm that the Legacy West Midlands staff are being vaccinated. I would urge everyone who is offered the jab to take it, please. So these are community organizations who are on the front line helping during this pandemic, who are getting vaccinated. And I know there were some pictures posted on the team earlier today. Here's a question from Soul Mass. How has the situation changed from a week ago, from a month ago, and what's the predicted situation for the next month? Ian, do you want to quickly give us a response to that, please?
Yes, so we often say that basically the people that are admitted to hospital today are the people that caught COVID 2 weeks ago. The people that get admitted to intensive care are the people that caught it 3 weeks ago. And I'm being pretty blunt here, and the people that die are the people that caught it 4 weeks ago who didn't get it. Now, our levels were rising very, very rapidly, that in our area, we were talking about 500 or so cases per 100,000 at the beginning of December. We've now been hitting the 1,000 mark. Cases have just peaked very slightly, or they're only going down very, very, very slightly. So although the headline figures that you might see in the news today seem to show that the figures are coming down, and people might say, oh, that's great, it's getting better. We need to bear in mind that it's not yet getting better, that today's admissions are the people that caught this 2 weeks ago. And for that reason, sadly, we think that the admission levels to hospital are going to continue to rise over the next week or couple of weeks. So in the next 2 to 3 weeks, things are going to get worse, unfortunately, before they get better. And that's pretty blunt, but it's true. So admissions to a hospital are going to continue to rise, I suspect, sadly, over the next week or couple of weeks. We hope that by the first week or so in February, we'll have then hit that peak, and then they will start to decline. The one positive thing, of course, is we do know that the vaccination campaign did start to roll out towards the beginning or end of December. We've immunised now the majority of people in our care homes. We hope, therefore, by protecting them, at least we can stop them now from getting COVID, and that will help to mean that the peak will start to come down a little bit quicker. But sadly, the answer to the question is things are going to get worse for the next week or couple of weeks before they get better.
Thank you, Ian. Question for you, Masood. I don't know whether you or Pip is best placed to answer this. What have been the main issues that have been encountered when distributing the vaccine? Who wants to take that?
I don't mind. In terms of the main issues, I think the main issues really have been, I think it's really been about making sure that we don't leave anyone behind, we don't miss anyone. And that's always the worry. I think as the supply comes in, and again, remember, this is a national program, so we can only deliver whatever we get. And as soon as supply is coming in, we are delivering it. And we had a lot of challenges at the beginning because the Pfizer vaccine had to be stored at -70. There are very strict controls around how to mix it up and deliver it. And actually, I've been to our vaccination sites, and when I've seen the organization, when I've seen how smoothly run it's been, there's always that little bit of a learning curve. So on day one, you're not going to be operating at full capacity, but by day 3 and day 4, you're flying. And that's what we've seen. I think the biggest issue really is just making sure that we don't forget anyone. And so that's why I say it, if you get invited for a vaccination, please come. You have a vaccination waiting for you with your name on it. Don't miss that opportunity, because that's what's going to save lives.
Yeah, I think just to come in at the back of that a little bit, Masood, one of the things that I was thinking about was This vaccine is really valuable to us. I don't mean financially necessarily, but it's valuable to us. It will, you know, it will help us to move forward safely with our lives. It will protect the people that we love, and it's really important that we have the right number of people booked to receive the vaccine that comes down into our area, and the logistics of matching that up so that we don't waste any has been really quite considerable. So, you know, we're having to make assumptions that people will want the vaccine, and if you get an appointment and for some reason on that day you choose not to turn up, then there's a vaccine there that's lost, and that could be a life that could have been saved. And I know I'm saying it really bluntly, but if you get an appointment and you don't turn up, then there's a life there that we could have lost as a byproduct of it. So it's so important that we match that exactly, so that we don't waste anything that will save people's lives.
Great. Ian, how effective is the second jab 3 months after the first?
Right, and that's a very good question, and that's the reason 3 months has been picked, because we want to make sure that, as Masood said, as many people get this vaccine as possible. We know after the first injection, within 2 to 3 weeks, you will actually get very, very good coverage. So people are going to be somewhere between about 50 to 90% protected, using figures just very, very, very generally. But when you've had one injection, that protection will start to drop relatively quickly. So within a few months, that protection will go from 90% maybe down to just 30 or 40%. Hence, the second injection is the booster dose. And what we hope is, therefore, that you have the second injection, and that will give the body a reminder. It will continue to stimulate the immune response, and we will get between the vaccines all differ a little bit. The bottom line is they're all very good. After the second injection, it will bring your immune level back up, and it will bring it to somewhere between about 70 to 90%. That means that 70-90% of people will not get the infection at all, or if they do get it, it will be very, very mild. There'll still be a few people that may get the infection. We need to bear in mind that those people that still do get the infection are much more likely to get it much more mildly. What we don't know, and this is the difficult $64,000 question, as it were, is actually how long that immunity will last. Will it last for 6 months, 6 years, 20 years? We don't know. And I think we need to work on the assumption that we may need to be giving people a booster dose in 12 months' time, but that's a question for further down the road. So at the moment, we don't quite know how long that immunity will last, but we certainly hope it's going to last for several months. That would be the question. There were just a couple of other things I quickly picked up as well, which I could also answer. Somebody asked, will we be doing the housebound? Well, the housebound are obviously a difficult group logistically. We are in the process of looking how we are going to immunise that group. They are very important. And in fact, over the next 2 to 3 weeks, immunisation programmes for the housebound will be going out. So they definitely haven't been forgotten. There was also a question about what's the best one, I think, to have, or which vaccine works best. They're all good vaccines. They all work well. You won't be given a choice, unfortunately. So this isn't about, well, I want one rather than the other. I want the British one. I want the American one. They're all good vaccines. They're all safe vaccines. They all work very well. I had the one that was offered to me, which was the Pfizer vaccine. Unfortunately, you don't have a choice, but they're all great. The other thing I would say is, the NHS will offer you a vaccine free of charge to everybody who's vulnerable. Ultimately, everybody over the age of 16 will be offered this. It should be the NHS that's ringing you up and contacting you. If it's not the NHS, or if anybody says you've got to pay any amount of money, that's a scam. The NHS will give you this vaccine. It's free. Everyone will be offered it eventually. If someone other than the NHS is offering it to you, be very aware. Thank you.
So I was muted there. We've got quite a few questions. So if we can have some short, concise answers, please. I'm also getting some questions via text. So one of the questions is, we talked about Summerfield and Enki, City Hospital, the Villa. Can you elaborate a bit, Pip, on where these are, precise addresses, and who is likely to go to which particular location, or is it just a bit of a lottery?
No, not at all. It's not. It's not a lottery. So what's happening at the moment is that the hospital sites are mainly at the moment doing health and social care staff. So they've got a huge remit to make sure that the workforce is safe. And then beyond that, the GP practices and the mass vaccination sites like Millennium Point and Aston Villa are there to offer vaccinations to the public and all citizens. I think Masood spoke about it earlier, but there's a prioritisation list that we're working our way down, starting with the over 80s, with care homes, with people who are housebound, and then working down through the age categories to include those who are clinically vulnerable for some reason. And you will, from your GP, when it's your time to go, you will get a phone call and you will be invited. And you may also get a letter that comes out nationally from the NHS inviting you to book at one of those large vaccination sites. It could be that those two things come to you at about the same time, in which case you have a choice as to whether you book to go to a large site like Millennium Point or go to your GP. Or it might be, I know at the moment, the GPs are doing a fantastic job and actually are working their way down through those groups really well at the moment, and I think they're ahead of some of the invites that are coming out from the nationals to book into the mass vaccination site. So that's the way it's working at the moment in terms of how it will happen. Yeah.
Pip, I think this is another question for you. Do you have a quota for how many people will be vaccinated each week? And what is the state of implementation of the vaccination here in the West Midlands?
So we have to vaccinate as many people as we get vaccine for. That's the reality of the position that we're in at the moment. Because as I spoke about earlier, we can't waste it. It's too valuable. And at the moment, every vaccine that comes down into the area we're using. So it's not about quotas. It's about using it to best effect. We've got a fully implemented vaccination programme now across the West Midlands, and I've seen a question about, you know, when it will go to kind of full capacity, and the speed of vaccine coming down now is increasing all the time to us. So as our services are ready, and they are now, and they've kind of they've got over the initial teething problems of working out how this happens, then the capacity is growing and the supply of vaccine will grow. So that's how we see that happening. But we don't have a quota, but every bit that comes to us we are using, absolutely using.
Thanks, Pip. Masood, this one's for you, I think. Raf is saying, I would like to ask, if everyone has come together for this vaccine, then why not a cure for cancer? It's just a monopoly.
And I've seen Raf has asked a few questions, actually, very good questions. So in terms of cancer, there are so many different types of cancer. Let's take one example, multiple myeloma. If you look at the number of new treatments that have come out in the last 10 years, you'd be surprised. So again, it depends on what you're looking at. So as we improve our research methodologies, as we look at different ways of kind of treating different illnesses and diseases, actually we're very fortunate. There are a lot of new treatments coming out all the time. And so when you say, why isn't there a cure for cancer? Well, multiple myeloma is one example. If you Google it and look at the difference that it's made in treatment, there's been loads. But again, not every cancer is the same, and therefore research into it and the treatments, they're not the same either. I think the example here is that actually we had a global pandemic, and so the focus was shifted and everyone was working on it and dropping a lot of other things. So, you know, that's the reason why we are where we are. And we've seen the impact. It's been global. It's been, you know, no one is protected, no one is safe. It's affected all of us. And that's why there's been such a huge effort worldwide to get a vaccine.
Thanks. I'm trying to take as many questions as possible.
Yeah.
So this is a two-part question from.
I was going to say, Councillor, it's the same thing. That actually, if you look at the treatments that are available for AIDS, they're phenomenal. Now, you can't always get a cure, but what you can do is you can treat the illness. And AIDS is not the same as it was decades ago. You know, a lot of people now, if they develop HIV, they get treatment and they live normal lives, and that's the difference.
So a comment here from Bridget Parsons. Thanks for setting this up. I had my vaccine last week, and apart from a slightly sore arm, no side effects. So there you go. And I'm trying to post all the challenging questions as well as some of the positive ones. It's important that we take all questions.
We talked about this before. Moving to 12 weeks, the strategy was there to protect as many people as possible. And so, you know, with NICE, they looked at a certain condition, a certain set time frame, and they made a judgment based on that. But what we're doing, if it wasn't safe, it wouldn't have been approved. And so I'm the first to agree that, you know, it's not as good protection, but if it means we save more lives, that's the goal.
Right. I know we've gone past the hour now, but we'll try and wrap up in a few minutes. So here's somebody whose parents have had their first dose of the vaccine, and clearly say people in the community who think the government have some hidden agenda. So Ian, does the government have a hidden agenda when it comes to this vaccine?
Absolutely not. I mean, there have been many things I would disagree with the government, maybe haven't always got things right, but what the government do want to do is to get this vaccine out and help as many people as possible. But the key thing is we've seen that our NHS is literally becoming overwhelmed. That's the main reason, I think, for changing the we want to stop people getting infection, but our main priority at the moment is stopping people from dying from this disease, stopping people from going into hospital with it. And by giving them one injection, that's what the government want to do. They've spent millions of pounds on this vaccine, not for their benefit, but for our benefit. There's no hidden agenda. The government wants to save people's lives, keep people out of hospital, and allow us to try and get back to as normal life as possible. When will the vaccine begin on the housebound for the over 80s? The answer to that question is hopefully within the next week or so. It's a challenge, but vaccines are going to start rolling out to the housebound within the next week or so.
Ian, it's started in West Birmingham.
Oh,
sorry, what did I say?
I said we've started in West Birmingham.
Already started. Fantastic.
Councillor, I'd like to make one point. I mean, I've seen a number of your viewers have said, how can they help? And who do they get in touch with? What I would say is get in touch with Councillor Waseem, and he will redirect your details to us at the CCG. We need champions. We can direct you to trusted sources of information. And actually, thank you for that. You know, that's how we can only beat this together. And so for the more of you that help us, the more of you that have attended this and spread the word, that's what's going to help.
Great. I am going to have to wrap this up. There's so many questions coming in. It's been brilliant. Thank you for the engagement. As Dr. Masood just said, we'll be more than happy to take any of your questions or comments on board. If you've got any questions or comments, you can contact me, whether it's through social media or drop me an email, waseem.zaffar@birmingham.gov.uk. And we will try to get the right people, the professionals, to answer your question. I'm a layperson when it comes to health. I will pass your questions on to those who can absolutely answer them. So if you're not certain about something, and the best people to provide you with the advice of whether you should take this vaccine or not are obviously your GPs. If you've got particular health concerns, you're not worried. So I'm a type 2 diabetic. I've got some other underlying health issues. And earlier this week, I had a telephone conference with my GP, and we had a very positive conversation. And it was decided that I should be, there's nothing that should prevent me from having the vaccine when I am called to that. And I'm really looking forward to being called. To the panel, I hope this is the first of many such webinars that we have. I'm particularly keen to get colleagues from the CCG, health professionals who can speak community languages on future webinars, and I'm hoping colleagues who are watching this program, if there's a particular language you speak and you want to host a webinar, I'm more than happy to help facilitate that webinar. I can speak a number of community languages, but not all of them. So if you can speak Bengali, if you can speak Hindi, if you can speak Mandarin, Chinese, drop me a line and we'll get a health professional to sit in with you. We'll organize a webinar. I think it's really important that we do everything possible in the coming days and weeks to get as many people vaccinated. 10 seconds each, last words from each and every one of you, please, before we close up. Start with you, Ian, please.
All I would say is I've had my vaccine because I think it's fantastic. You need to get yours as soon as it's been offered to you.
Great. Pip?
Exactly the same. Get the vaccine. It's the thing to do, but also keep asking questions as well. And if you are coming across people who are hesitant, let Councillor Zaffar know. Let one of us know. Those of you who know me know I love talking, so I'm really happy to come and talk to anybody at any time. Thank you.
Great. Masood?
Get the vaccine. And the reason is you protect yourself, you protect your loved ones, and you protect the NHS. And together, we can beat this.
I want to say a big thank you to the panel for joining us today. I want to say a big thank you to all those that watch this program. If you've enjoyed it, if you've liked it, please do share it with colleagues at work, with your family and friends. Look, we are in a very difficult time. We're living through totally unexpected times with this pandemic. As I said at the start, I think each and every one of us has come across somebody who's been affected, and unfortunately people who've lost their lives because of this pandemic. We've got light at the end of the tunnel with this vaccine. We do get that call. Please do take it up. And if you have any concerns, have that discussion with them. And I want to really encourage some of the young people within our community. Please do talk to your elders, talk to your parents, your grandparents. If they've got any concerns, if there's any language barriers, do facilitate those conversations with the health professionals and encourage them. This vaccination could save somebody's life in your family. And to the young folk out there, some of them are saying they're not going to get vaccinated. I think it's really important when the time comes along and you get that call, because everybody ultimately will get the call in the coming weeks and months. Everybody, irrespective of how old you are, whether you've got underlying health issues or not, you should be taking up this vaccination. It will only protect you. I just want to say a big thank you to each and every one of you again. Have a good night, stay safe and take care.